things down, but I thank everybody for coming out this afternoon. I know it's a rainy afternoon and there are other things you can do, but I think what we're announcing today can have a significant impact on a lot of families across Illinois and across the nation. Just this last week on Thursday, on World Autism Day, I introduced in Washington legislation to deal with the challenge of autism for so many families and for our nation. The Center for Disease Control estimates that 1 out of 150 children are diagnosed with autism spectrum disorder. That overall incidence of autism is consistent around the world. In Illinois, there are over 26,000 families caring for a family member. Autism is 4 times more prevalent in boys than girls. It places tremendous health, financial, and emotional strains on everyone's family involved. The Harvard School of Public Health reported last year that the cost of care for an individual with autism over his or her lifetime is over $3 million. The cost of care for and treat individuals with autism spectrum disorders in the U.S. annually, nationally, is over $35 billion. In a study by Easter Seals last year, over half of all parents with children with autism reported their child's care is currently draining their financial resources, as you might expect, and will cause them to drain their family finances in the future and fall short of cash during retirement. It's a tremendous strain on families, financially and emotionally. Private insurance coverage of autism varies widely. We talked about that for a few minutes before we came in the room here. And many major insurers specifically exclude autism treatment in their policies. Applied behavioral analysis is a proven therapy that's been shown in studies to produce substantial gains in IQ, language, academic performance, and social behavior. 8 states, including our own state of Illinois, have passed laws that mandate insurance coverage for autism treatment, including ABA therapy. Paying for treatment out of pocket is very costly. Applied behavioral analysis therapy can cost up to $50,000 a year and maybe more. Researchers widely agree that children with autism who receive prompt treatment and early intervention services can improve their long-term functional prospects dramatically. Now, we have a bill that was signed last December, Senator DeLeo and Representative May, which has insurance coverage in Illinois. But as I've spoken to some people here, it appears that it's not as complete and comprehensive as we might like to see it. I want to thank so many people for gathering here today to talk about the bill that I've introduced, and I just want to briefly describe the major elements of this bill. First, it creates autism care centers demonstration projects, and the object of this is to create in some areas the go-to place for those families facing autism, so they can find the best providers, they can find beneficiaries to designate a personal primary care coordinator as a source of contact for a family, and find a full array of medical, behavioral, and mental health, educational, and family care services. We also have an adult services demonstration project, which is something that my wife brought to my attention because of people that she had met over the years, that when children reach the age of 18, that's a new challenge. And these new challenges have to be met, and we're going to try to serve that need with these adult care demonstration projects. There is a voluntary, let me underline, voluntary national registry for those families that want to participate, in the hopes that if we gather information around the country, it will help us come to understand the root causes, the rates and trends of autism. There's a public education and awareness campaign, an interdepartmental coordinating committee of all the agencies, federal, state, and local, and you can imagine there are many, to try to make certain that we coordinate their services. A national network for autism spectrum disorders research and services, a national training initiative so that we can use the best practices and improve services around the United States, and the requirement that health insurers cover the diagnosis and treatment of autism spectrum disorders, including applied behavioral analysis therapy and assistive communication devices. When my staff came to me and said that the autism groups really would like to see this legislation, I said to them I didn't quite understand it, because just last year we passed legislation that said that mental illness needed to be covered in health insurance policies, something that I think should have been done a long time ago. Well, we know that physical illnesses are already covered by health insurance. And I said, then what is autism? Doesn't it fall in one of these categories? And as Dr. Nair explained to me earlier, it's been defined out of the categories by some. The net result of it, of course, is families are left on their own with no health insurance coverage to turn to when they face the awesome responsibilities and costs of dealing with an autistic child. So this really plugs one of the gaps and one of the elements that I think needs to be covered. People need the peace of mind of knowing that they're getting the best care and that it isn't a matter of running out of personal funds and denying that care to a child that needs it. Another element came up during the course of our earlier conversation, providing training for families and parents so that they can deal with the needs of the autistic child in many different respects. So it isn't just direct treatment of the child, but also the training aspect that becomes so important for so many families to cope with this. We have several people here who know this issue far better than I ever will, and I'd like to ask them to say a word. Sherry Ladislaw is a parent of a child with autism. She's the Director of Public Relations and Fund Development of Trinity Services, a major human services provider based in Joliet. Sherry?
Thank you, Senator. Good afternoon. When my son was diagnosed in 1993 with autism, nobody really knew what it was. No one told me where I could go for help or services, and I was pretty much left to my own devices and trying to find things that would help him acquire skills and learn to be all he can be. And today he's 18 years old, and this sweeping legislation just has me so excited on so many levels because it addresses so many unique challenges that we as families or parents of children with autism face. I'm especially excited about the demonstration projects. The care centers are going to be so helpful for families who are just getting a diagnosis. They can go to one place and there are no secrets. Everyone will be told where you can get, what sort of help you can get. Now we have, my son's 18, and we've got a tsunami of kids coming our way who are turning into adults. So the adult demonstration project is very exciting to me. And today, my son's future and the future of others like him looks so much brighter because of this legislation. And I want to thank Senator Durbin and others for introducing this. It's very, very good news.
Thank you. We have Senator Bob Casey of Pennsylvania and Bob Menendez of New Jersey are co-sponsors of the legislation. Becky Moore is the mother of an 8-year-old son, Jacob.
Yes.
Lives here in Springfield. Becky's been an active client at the autism program and in the Special Olympics. Becky, say a word.
Thank you. Thank you. I just want to say this is an amazing coup for Illinois, this legislation, and for our nation, but most importantly for our children who have autism, and for us as families who love our children and work with them and want to help them and want to help bring their lives to a very positive, independent adulthood. And I'd really like to thank Senator Durbin and Dr. Nair and the autism program. It's been phenomenal, such a support to our family. And whereas autism has come a long way, and I know we've all seen Rain Man, and we have those pictures in our mind of what we think living with a person with autism is like, but autism is such a broad spectrum, and it's such an amazing range. It goes from just children who are very high functioning all the way to children and adults who are very debilitated by autism, and so there's everything in between. But it's very challenging, and it's every day. And we love our children, and my little 8-year-old Jacob is just a doll. He's a good little boy. He likes to be a good helper, but the autism really hinders a person's ability to communicate and to understand. So as a result, many of our children who then grow into adulthood do not always understand what we're expecting of them, what we are asking them to do, what we expect, and they also in turn cannot always communicate appropriately or articulate how they think and feel, and as a result it's incredibly frustrating, and then you have the behaviors to deal with. And so these types of legislation bring forward more assistance to our children, to our families, not only directly to our children in terms of receiving services, but to us as parents to mentor us on how to best help our children. And so it's just been a blessing.